Welcome to the Medical University of South Carolina. What's a kidney transplant biopsy? Kidney transplant biopsy is performed to obtain a tissue sample from your kidney transplant. That tissue will be examined by a pathologist under a microscope to get a closer look at the structure of the kidney. Why do we do a biopsy? We perform a kidney transplant biopsy for a variety of reasons. Primarily, we're looking to diagnose the type of kidney injury. One of the causes is rejection. This means your body immune system has figured out that there is an intruder and is trying to fight it off. We also look for other possible injuries, including recurrence of native kidney disease, infection of the graft, and the amount of viable tissue in the graft. By biopsying the kidney, we can diagnose the cause of kidney injury and determine the appropriate treatment. What does a biopsy entail? Before your kidney biopsy, you will meet with your doctor to talk about what to expect. This is a good time to ask questions about the procedure and make sure you understand the benefits and risks. Your doctor or nurse will let you know when and what to stop taking certain medications and supplements and for how long. Examples are aspirin, Plavix, or other blood thinners. These medications are usually stopped 5 days before the procedure and then started again 5 days after the procedure. You may be asked not to drink or eat for 8 hours before the kidney biopsy. During the procedure, we will be using an ultrasound to help to guide our biopsy. When you first arrive in the room, we will have you lay flat and lift your gown to expose your abdomen. This is how the room setup will roughly look like. Using the ultrasound probe, we will look for a good view of your kidney transplant where we can safely biopsy. Once we find a safe view to perform the biopsy, we will sterilize your abdomen with a small medicated sponge. You will then receive the numbing medicine injected into your abdomen. This is meant to numb the path that the biopsy needle is about to take, ensuring that you feel no pain. You may feel a burning sensation when the local anesthetic is given, and you may feel pressure once the biopsy needle itself is inserted, but you should never feel pain. After numbing your abdomen, we make a small incision in the skin and pass the biopsy needle through. Using the ultrasound to guide our needle, we'll slowly advance to the kidney and obtain a sample. You will hear a click sound when the tissue is obtained. A pathologist will be in the room to determine if we need a second tissue sample or if the first sample was adequate. Afterwards, we will hold pressure for 10 minutes. A repeat ultrasound is performed to make sure that there is no bleeding, and then we're done. You'll stay in the recovery area for approximately 2 to 4 hours on bed rest. Following the procedure, you're advised not to lift anything heavy for 2 weeks. Take it easy and avoid exerting yourself. What are the risks of a kidney transplant biopsy? Bleeding is the biggest risk. This is why we make sure your blood pressure is well controlled prior to the procedure and you stop all blood thinners. You may notice blood in your urine following the biopsy. This is not uncommon, but it should lessen each time you urinate. Soreness or pain are other possible side effects. These should be mild and improve in hours following your biopsy. Infection is also a risk of this procedure. This is why we use sterile technique to minimize exposure to pathogens. If the bleeding or pain worsens, call your transplant coordinator immediately or go to the nearest emergency room. Under certain circumstances, we seek interventional radiology for a CT-guided biopsy. Few examples include when part of the small bowel is overlying the kidney, as the risk of accidentally poking the bowel is too great. Another scenario, if a bleed has developed after the ultrasound-guided biopsy within or around your kidney. Intervention radiology will be called to emergently embolize or zap the bleeding vessel or the arteriovenous fistula formed within the kidney. As a side note, bleeding might subside completely after a kidney biopsy but starts to appear few hours to days later. If this happens, call your transplant coordinator immediately or go to the nearest emergency department, as this may be a sign that an arteriovenous fistula has developed within the kidney and needs attention. That's it. Thanks for listening.